clinical practice. So before we start Rumex, we should know Rumex is a which type of a patient. It is a chili patient, and it is comes from which family? Vegetable kingdom or vegetable kingdom, and its common name is what that is yellow dog. Yellow dog. So therapeutically, where we use Rumex, mainly 3 points we should always remember. That is one is for cough, dry cough. We use Rumex, dry cough. That is most common therapeutic use of Rumex. Most common is dry cough. Then our skin symptom, skin, and rare prescription is your diarrhea. Rare is diarrhea. So most commonly Rumex used in clinically therapeutically dry cough. So first we started with dry cough. How it is a dry cough will be? The dry cough, all those complaints will be sudden and exposure to cold, because it is a chilly patient. All the complaints are aggravated by chilly cold things. So constitution is what? It is a tubercular diathesis. What does mean tubercular? Tubercular diathesis means that mainly in children, some children are having the tendency to get cold easily, have glandular affection, have means if we treated by initial period by this medicine, then their tendency to go for TB exposure or TB cough like TB symptoms are decreased. So diathesis means prone to or susceptible to a particular disease. So they are tubercular diathesis. Extremely skin mucous membrane are extremely sensitive. Okay, now throat, it is the important part of that throat. That is throat is what? Raw sensation is feeling, along with there will be lump, descend on swallowing but return immediately. Okay, descend on swallowing, it is a sensation, that is raw sensation, along with sensation of a lump which present, and he feels that it get swallowing, it get down, and then it comes back. So larynx and trachea, there will be raw sensation. Raw sensation will be happen where? Larynx and trachea. So we know many raw sensation feeling, evening hour raw sensation feeling, allium cepa, our your pulsatilla, they are having evening time raw sensation. But here it is raw sensation while coughing. Coughing is the important point. Coughing, there will be raw sensation. Okay, that is the important, you should remember. By causticum also there will be raw sensation is feeling is there. Causticum, pulsatilla, they having Rumex type cough, and raw sensation are also present in that. Cough causing involuntary urination is also pulsatilla. You can get that cough involuntary urination. Pulsatilla, you can get pulsatilla, causticum. So causticum, there will be during urination due to bladder weakness, there will be silesia. So 4 drugs you should always remember about involuntary urine during cough. Then all the complaint dry cough or anything, then GI, how can we remember GI things? GI things always remember by comparing with podophyllum. Podophyllum we get painless, profuse, putrid, and polychromatic color. Here also like that, morning diarrhea will be found in podophyllum. Morning diarrhea is there, but here it is 5 to 10 m, and the stool is painless, profuse, offensive. Putrid or offensive, putridness is right in podophyllum, but offensive is right in Rumex. So you always remember podo, then you can catch the you can write the GI symptom. So diarrhea is the chief complaint, mainly character is painless, profuse, offensive, suddenly urging occur, and it will be drive up the bed in the morning. So like aloes, you have goggling of sensation, morning diarrhea is there, natrum salt is there, the morning diarrhea alternate. Then sulfur also, you know, sulfur morning diarrhea, when say you want to bed, after bed touch the ground, diarrhea will be appear, or tendency to eat. So this is the important. But how can we compare, means how can we compare? In natrum salt we have the green sputum, like in natrum salt we have green sputum. In green sputum along with the diarrhea, then we can think about natrum salt. Aloes, you know, goggling sound, the complainer relief by eating cold food, like that you can get. But aloes is not more natrum salt, podophyllum I tell. Now respiratory is that extremely sensitive to open air, where other drugs can be natrum, pulsatilla also. Even cold air inspiration, he feels sensation of a lump. You can remember by like that. If we go to cold air, there will be lump sensation is found. So extremely sensitive to open air, like our but natrum, pulsatilla, these are open air sensitive. Hoarseness, hoarse in the evening. Pulsatilla, always remember by pulsatilla and Rumex comparison, you can remember everything. Pulsatilla open evening hour aggravation. Allium cepa also evening hour aggravation, you can remember by this. Then what happened? There will be tickling in the throat pit causing dry and a teasing cough. tickling sensation is found with causing dry and a teasing cough. So dry cough, where other drug, aconite is our dry cough, then your belladonna is also dry cough, your brownia also dry cough, your spongia also dry cough. So you can remember by comparing like that, what are the drug of spongia is the dry, brownia is dry, belladonna is dry, drosera is dry. So 5 drug you should always remember about comparing their dryness. If question can examiner can ask that okay, dry cough you tell, now you tell the productive cough. So productive cough, what are the drug? Productive cough, there will be productive, always there will be ipecac is there will be seneca is there. So you like that you can tell the productive cough. Calibi is there. Okay, the cough is small and it comes so in that way you can remember. Then Rumex is that what it having words from changing air, we can remember by phosphorus and spongia. Phosphorus and spongia, like that it is also having, even lying down it causes aggravation, then dry, you can remember dry incessant. What are the dry cough I told? Fatigue. Incessant means continuous cough will be occur, changing of air and room, like phosphorus and spongia. And how can we compare? By phosphorus there will be cold things amylation, and the left side it is more affected, like lactasis, phosphorus, spigelia, pulsatilla, these are left sided drug. Spigelia, lactasis, spigelia, phosphorus, your phosphorus, and another is your pulsatilla. Pulsatilla is your left sided remedy. So Rumex also left sided remedy. And then slightest inhalation of a cold air covers head with bed clothes. Okay, means he cannot tolerate cold. Chilly patient highly sensitive, so always cover the child, cover his head with bed clothes to make it warm, so that there will be no expectation or little no expectation is we find in the cough. Cough is aggravated cool by anything which causes inspired. If we see inspired something, it can causes also cough. Like phosphorus, we can see that like that we can get here also. So always remember, like Rumex, these are what are the oversensitiveness, these are what, that much you remember. Skin is the most what skin is the is a common symptom which comes in Rumex, that is itching of the various part by cold. Cold is everything, everywhere. Cold is aggravation is their skin symptom. And you always remember by warmth it is amylation, uncovering or exposed or when undressing. So how can you remember? By compare with the Rostox. Rostox also cold aggravation, damp weather aggravation, the warmth amylation. There will be undressing or something. Person said when I go to home and after undressing I feel so much itching. So cold air when get exposed, then it causes so much itching. So we can by Rostox we can compare and we can remember these things, because Rostox is also find this much. So this is the common thing. GI I told, along with always remember GI along with your skin respiratory if come, we can give our Rumex. So this is all about Rumex. Thank you. Rumex, always remember chilly patient, dry cough, skin itchy when undressing, and your raw sensation like causticum. Always remember causticum, pulsatilla, phosphorus in case of left-sided throat complaint, and dry cough you can remember the common drugs. Along with you can remember evening hour like alemcepa, pulsatilla. There will be itchy like